Hi, thanks for taking the time to come and watch. This video will give you an insight into Caci beauty treatments. Today I'm having the Caci Face and Jowl. Don't worry, you won't have to watch the whole hour and 15 minutes. I've cut it down just to give you a taster. I hope you enjoy it. Happy watching.
So what would you say the benefits of Caci are if somebody asked you? What do most people use it for?
It's basically like a workout for the face, really. Workout for the muscles in the face, yeah.
So it lifts by naturally working the muscles?
Yeah, that's it. Works on the collagen and elastin in the skin as well. So
does it help produce more collagen then?
Not necessarily, but it just helps to plump up and tone the muscles really in the face.
Okay.
So going to the gym for the face, yeah.
And alright, you have 10 sessions to start with.
Yeah, that's it. So, yeah, 10 sessions. You need to come in quite frequently.
Okay.
Sort of 2-3 times a week, if possible.
I remember doing that.
That's it. The more frequent, the better. You need to leave a day in between.
Right.
Each facial. And then once you've had your course of 10, and then you can go to sort of a maintenance program where you come in sort of once a month. But like anything, you need to keep it up really.
Yeah. And why do you have like the separate jowl part of it?
So the jowl treatment is really specifically for that sort of area around the chin for ladies that are concerned with this sort of lifting and firming and toning of this area.
Right.
It's really good for that area and underneath the chin as well.
Okay.
Just lifting and toning that area.
Gives it a little bit more of a workout
than
so you
can
standard.
Have yeah, that's it. So you can have that as a separate treatment on its own, or you can incorporate it with the full facial like you're having today.
And do you have any other Caci treatments that you do?
There's one specifically for the eyes as well.
And what does that do?
So that's obviously for concentrating on the sort of crow's feet around the eyes that some ladies can get.
Okay.
Sort of lifting and toning those areas, all this area as well, and sort of good for the dark circles and things under the eyes as well.
Oh, okay. Oh, I hadn't read that one. So
but again, you can incorporate that into the full facial as well. You can sort of have extra work around the eyes, which is quite good if you're concerned about that area.
Would you use any of the sort of moisturising things while you're doing it?
So the cotton buds have actually got like a sort of firming serum inside them. Okay. So they kind of help to lubricate the cotton buds as they're sort of going over the skin, so they're not sort of dragging or pulling the skin, and also the products can sort of seep into the skin as well, so it's
sort of massages it as you're going.
That's it, yeah. So at the end of the treatment, the last bit of the treatment, you use a Decleor sort of serum and oil and a cream at the end of the treatment, and sort of massage that into the skin as well.
And what age would you say people generally would start having Caci from, or does it vary?
I think you could, I'd say sort of late 30s to 40s really. Yeah, as young as late 30s to early 40s, yeah.
So what you're doing now is targeting specific muscles, is it?
That's it, yes. It's working on that sort of lower, on that jaw area. Yeah. Does that pressure feel okay?
Yes, absolutely fine. Because the treatment lifts muscles or helps tone them, does it also help with fine lines?
Yeah, it does help with the skin slightly as well. I mean, the main benefits are the sort of lifting and firming and toning of the muscles.
Yeah.
But it does help with the fine lines and wrinkles as well. So it's also working on the skin texture and tone.
In terms of maintenance, how often are you supposed to have it?
Well, you've got the initial course,
Yeah.
so you'd have 10 in the initial course, so 2 to 3 times a week.
Yeah.
But the maintenance, yeah, every month really, after that, after you've had the initial course.
But if people wanted to do it a little bit more often, they can, or...
Oh, cool, you could come in every week if you wanted to,
Yeah.
yeah. Yeah, that's no problem at all. The more often the better, really, I suppose. But you do need to leave a day in between each facial.
And what's the actual technology? How does it work? Do you know?
Well, you've got this sort of a small sort of current sort of travelling through, really.
Right.
And then these sort of cotton buds are acting as the conductor with the serum inside there.
Okay, so it's
So
all
it's just
an electric current.
Yeah, that's it.
basically,
Just
that's
a very
working the
small,
muscle.
very small electric current. Yeah. Yeah, some people don't move at all, but other people can really the eyes sort of start going, and
Oh,
you
really?
can see the flashing colours, can't you? Sometimes flashing lights, which is
Yeah,
normal.
I do get a little white light sometimes flashing.
Do you still get that sort of metallic-y taste, or?
Yeah, I can do it. I can taste it now.
Can you? Yeah.
But yeah, only when you're around that area, really.
Yeah, just around the mouth there.
Yeah.
It's quite normal to go a little bit red as well.
Yeah, I've noticed that just
bringing all the blood to the
afterwards.
surface. Yeah, I mean, some people go more red than others.
As you say, it's a good thing because it's bringing the blood to the surface.
That's it.
and
Yeah, stimulating.
Stimulating it. Do you use different parts for different bits of the face in terms of the...
Yeah, I mean the bits that I'm using now, the attachments I'm using now, are just for the jowl.
Yeah.
So they're bigger attachments.
Oh, okay.
And I'm going to I finished the jowl part now, so I'm going to pop the other attachments on now for the rest of the face.
Oh, okay.
So they're smaller, just to get in different areas of the face.
Ah, got you.
Okay.
Thing I noticed is that you all do it slightly differently. You
Mm.
don't, yeah. But you go and you get trained, and then you find your
Yeah,
own way of
that's
doing
it. You
it.
adapt your way of doing it. Yeah, I think as long as you're covering every area,
Yeah,
and every muscle in the face, then you're fine. But yeah, we do all have a slightly different.
Yeah, it's slightly different. Yeah.